Hey, sorry about that. My internet is usually pretty good. I'll just wait for Lani to tune in again, and hopefully you all come back and watch us. Because we definitely want you here. Let's see how we go. Um, mhm.
Hi.
Okay,
Yay.
awesome. Let's see how we go. Hopefully, yeah, it stays with us. But anyway, yeah, we will upload this. And both of us are free to chat to you about this as well. If you have any more questions, if any bits sort of dropped out or anything, let us know. And if you have any questions, we can answer them afterwards as well. So,
For
what are we
sure.
talking about? I feel like I don't know. I feel like these have turned into a weekly event because in the birth world, something sort of keeps coming up every week. So I'm kind of hoping this is
Yeah.
a thing because it's getting a bit ridiculous. Um,
It'd be nice to have some like positive sort of like
yes,
talk.
that's good too. Cool. So, with sort of what's happened and gone around this week, we're going to be talking about epidurals. So how this all started is a post that was made viral, I guess, from a hospital in Canada, which had a kind of very forward letter saying that women who are birthing at that hospital are required to have an early epidural in labour. Um, this is so many things. An absolute
Mm.
violation of human rights is one of them. Um, so we kind of just want to talk about tonight about what an epidural kind of entails and the effects that it can have on you, because some people might be questioning why that might be, and I guess we'll go through that as well, why a hospital would request that a woman has an epidural. Um, but I think if you're fully informed about the flow-on effects of an epidural, then it kind of becomes even more serious than what it already is. For one, the hospital did state that it requested women to go to a different hospital if they did not want to have an, or if they did not accept the epidural, which in itself is actually illegal, especially here in Australia, especially in a public hospital. You can't deny a woman care. So if a woman comes to you in labour, you can't tell her that she has to go somewhere else. We have an obligation to provide care. Um, and unfortunately, this isn't just something that is limited to in other countries. And I have done a lot of talking to people and finding out information, and it is something that is sort of happening in Australia as well. It's just not worded the same way. So it's not that women are being requested or demanded that they have an epidural. There is strong recommendations that women have an early epidural in labour. And I guess it's worth sort of like breaking down where that recommendation is coming from. So one of the reasons is that if a woman, actually, I'll start with that one last because that's the one we can elaborate on. Um, one of them is that it takes a long time for a theatre team to put on the extra protective, personal protective gear that is required to look after women during these times. So it adds time to if a woman is required to go for an emergency cesarean, and especially if the theatre team is off site and they have to be called in, they're just saying that's prolonging the time and that they feel that that is potentially endangering the woman and the baby. Um, one of the, but in saying that, having an epidural, which we will definitely go into a little bit more afterwards, is actually increases your chance of requiring a cesarean section. So we'll definitely go and elaborate
Yeah.
on that. There's um, restrictions as well on the use of nitrous. So a form of pain relief that is inhaled and exhaled. So what they're also wanting to avoid is a general anesthetic. So there's the rationale is if a woman already has an epidural sited and it's working effectively, that they can just top that up prior to performing a cesarean section, and that the woman will be less likely to require a general anesthetic. Um, overall, for all the women who end up having emergency cesareans, the percentage of women who actually require general anesthetic is pretty minuscule. It's lower than 10%. It is definitely not not the preferred analgesia going into a cesarean, because it actually has a lot more serious effects on the woman and the baby. So it's not as safe to do anyway. So it's something that is already avoided. So that was another one of the rationales. But one of the rationales that I saw, I still cannot actually believe this one. But the one that was stated in the one of the Australian hospitals' recommendations, what was the rationale for women being suggested an epidural, is because women breathe heavily in labor, and that increases the transmission.
I can't even
take it seriously. So in order to stop women being too heavy in labor, they are requesting that you get a very invasive procedure performed, which has
very risky procedure.
I absolutely don't. And this is not sort of like a go at anyone who chooses to have an epidural at all. This is about making sure that people are informed, so they're making a decision that is not one that they're pushed into because they think it's hospital policy. For one, hospital policy isn't law, and absolutely any decision that you make is your own. It's still, no one can do a procedure to you without your consent. So if you say no to something, then consent kind of becomes a wishy-washy thing in the birth world, and that's absolutely another conversation to be had. But no one can force an epidural on you, pretty much. So I guess let's sort of go into what is an epidural.
I think with just on the topic of no one can force you into having one, absolutely. But I feel that there's a lot of coercion that happens when you're in labour. I think women absolutely have a choice, 100% on how they decide to birth their babies, and that should never be taken away from them. But I absolutely, with my birthing experience with Liv, I ended up having an epidural. I wasn't informed of the risks at all during my labour. They were just sort of wanting to speed things along, and I hadn't progressed in a long time, and I was like, no, I'm not having one. And they were just like, yeah, well, if you don't have one, you'll end up with a C-section. That was pretty much the line I got given. And I was like, fuck, I better freaking do this. I don't want to end up with a C-section. I would say that while obviously they get you to sign all these pieces of paper and they sort of talk you through it, it's not, I wouldn't say that I gave informed consent. Yeah, I consented, but I was not aware of the risks and, the potential long-term effects of the epidural as well, which many women suffer from.
Yeah, and I think I think each hospital is different. One that I've worked at previously, women were required to sign a consent form to get into the bath for water immersion, but the anaesthetist would literally walk in the room and be like, okay, so you've requested an epidural. Do you know what an epidural is? Yep. All right, let's get on with it then. There was no discussion.
Yeah.
So unless women were had done their own research or were supported to have these conversations during pregnancy with their care providers, then no, it's really not an informed consent anyway. So what, I guess most people sort of know what an epidural is. It's a small needle that goes into the spaces between the spinal cord. It is and it kind of numbs the lower half, or sometimes just the middle half of your body, so you're not feeling the contractions. So it is quite an invasive procedure, and it definitely does carry some risks as well. So maybe we should start with the risks of an epidural itself, and then we'll go into the effects that it can have on your labor, your birth, yourself, and your baby as well. So so that there is kind of some sort of common side effects, and they're usually things like nausea and vomiting, itchiness. The epidural can be patchy, so it can work on one side of your body, not the other side of the body, things like that. then they can sort of become more severe as well. So one of the effects that happens is that your blood pressure can drop quite significantly. So to mitigate that effect, they usually give you a big bag of fluid beforehand, before they insert it and before they give you the medication, and try to bring your blood pressure up before you get the epidural. Obviously, your blood pressure affects the blood flow that is going across your placenta to your baby, so that can impact on your baby's heart rate as well. So there are circumstances where women's blood pressure drops so suddenly that the blood flow to the baby is quite compromised, the baby's heart rate drops, and women do end up with an emergency cesarean in that case. And
just on that quickly, Sarah, too. And when you have an epidural, it just happens to be the way that you end up on constant fetal monitoring. Is that correct?
Yeah, sorry, I probably should have gone through that first anyway, but it sort of does, it kind of makes your birth more medicalized. So if you had no reasons for monitoring or anything like that beforehand, you need to be monitored quite frequently, obviously, because they need to make sure that it hasn't affected your body in a bad way. So they give you IV fluid, so you have to have an IV cannula put in prior to getting an epidural inserted. You have quite frequent observations, so they do monitor your blood pressure every 15 minutes and then every half hour throughout your labour as well after that. Your heart rate as well, and then
the catheter.
You're not able to get up and pass urine, obviously, because your movement is quite limited, so they need to put in a urinary catheter, and more frequent vaginal exams usually, because they can't assess how your labour is progressing when your body's not showing those signs. But one of the things I find it really interesting that anaesthetists will say that it doesn't have any effect on the baby. The drugs don't cross the placenta, yet women are required to have continuous fetal monitoring, which is like the baby's heart rate monitoring with the straps around your belly if you have an epidural, which I find really interesting, because if it has no effects on the baby, why do we have to constantly monitor the baby throughout your labour and birth?
And so Sarah, sorry, another thing that they do is, I don't know if it's routine, it definitely was the case with my epidural birth, the fetal scalp electrodes that they put on to the baby scalp. Is that a common thing, or is that just if they can't get a good trace of the baby, they'll recommend, it's just a little clip on the baby's head, but it's actually like a tiny screw that screws into their scalp?
No, well, like within, I obviously find that quite an invasive thing, and within my practice myself, I found if women weren't moving around as much, external monitoring was usually absolutely fine.
I wasn't sure if that was just like pretty much like common practice, or whether it was just my personal experience. In my case, my heart rate was very high, my blood pressure was really high before I had the epidural, which is one of the reasons they talked me into it, because my blood pressure was skyrocketing because I was panicked and I was freaking terrified. But anyway, they couldn't get a good trace between me and Liv, and they kept getting us confused, and that's when they were like, look, this is just what we got to do. And I mean, that was freaking horrible in itself when I look back and think about, again, the cascade of interventions from this invasive procedure.
Yeah, and like sort of on that cascade as well, like obviously because your movement is limited and gravity and moving your pelvis is so important during labour, for the baby to be able to sort of like navigate the twists and turns and the bends of your pelvis. No, sorry, I forgot where I was going to go with that.
On that though, because your pelvic floor is numbed from this, so like you've got more chance of having a posterior presentation baby. Is that where you were going to go?
Yeah, no, but that's an important one as well.
Oh, anyway.
Interfere with your ability to move around and stuff like that. One of the other things that they also monitor is your temperature, because I think it's around 19% of women who have an epidural will spike a temperature. And even though we can trace this back to an epidural, it's never treated like that. It's a suspected infection still. And in cases where in particular places that I've worked where the nursery isn't attached to or isn't considered part of the maternity and postnatal ward, babies are separated and kept in the nursery because they suspect that there was a potential infection, and babies are given antibiotics. And obviously at this point in time, and with everything we're going through now and the fear of babies being separated because of potentially being infected with COVID-19, then the last thing you want in your labor is to have a temperature, even though it can totally be traced back to what it was from. Having someone threaten you with separating your baby, which also is something that is not allowed, but it's obviously something else that you don't want to try and be navigating during your labor and after you've just had a baby.
Sarah's just had a really good question, I think, as well. Is breastfeeding impacted by epidurals? Because I've heard recently by different health professionals that epidurals do not impact on the baby being less alert.
It absolutely does. So epidurals themselves have effects on your baby as well. So babies are more drowsy. They have like less sort of like muscle tone from the swelling from all the fluids that you were given during your labor. Whilst you have an epidural, your nipples are quite swollen as well, so it makes babies it gives them extra challenges in order to be able to attach. Babies also get all that fluid as well, so they weigh more at birth, and then it looks like they've lost more weight at birth, which means your breastfeeding is going to be undermined. That there's more.
I didn't realise that. That's interesting.
Yeah, more likely to be recommendations of formula in the early days because your baby's lost too much weight when really they haven't. It was just the fluid, and it impacts birth itself. So we've sort of gone all over the place here, but we've both made these mind maps today because it is such an intertwined kind of issue. So for women yourself, like the issues that an epidural can cause, so it can extend the length of your labor. So it means that your labor goes for longer. You're more likely to, this is what I was going to talk about before, more likely to need synthetic oxytocin to speed up your labor as well, because you're not able to work with gravity and things which help your labor to progress. So, and longer second stage, so the pushing stage of labor as well, so more likely to need intervention for that. So pushing, directed pushing puts a lot of pressure on your pelvic floor. You're more likely to end up with pelvic floor damage, which can be, lifelong and debilitating as well. It can lead to incontinence, prolapse, pain during intercourse. You're more likely to receive an episiotomy or experience a 3rd or 4th degree tear, which is sort of like an extensive tear that reaches the anus or involves the anus as well, and more likely to need an instrumental birth because you're not able to sort of use gravity to sort of push your baby out. So when things like forceps or a vacuum are used, obviously that is a lot more trauma on the baby as well. Babies can have a lot of be in a lot of pain, have a lot of bruising. And can sometimes even have lacerations like cephalhematomas, like swelling and bruising, and like in the head, which can lead to really serious things like bleeding in the brain, which absolutely affects breastfeeding for these babies as well. These babies are in pain, they don't like being handled as much, and also even just during the birth, from an instrumental birth, sometimes babies are more likely to have shoulder dystocia as well. So just birth trauma for the woman and the baby. And birth trauma, as we know, has huge implications on women's lives and how they bond with their babies as well. Do you want to go into sort of like the hormonal implications of an epidural?
Yeah, for sure. I thought I'd just touch on just with pelvic floor and like the potential damage after having an epidural and delivering that way. So I mean, after I had 2 hours of pushing with my epidural birth, and I tore. I didn't have an instrumental delivery, but they were talking about it. So I was just like, no, I'm going to push this baby out. I've come this far, vacuuming my baby out. I had a tear, but it wasn't too dramatic. But my pelvic floor was literally stuffed for It probably took until 12 months postpartum for me to have like full like bladder control again. Nothing ridiculously bad, but like I would have to wear a liner because like if I'd stand up too quickly, I'd leak wee for 12 months. And that was really fucked with my mental health because it was like, you know, it's like a normal bodily function to just be able to use the toilet properly. And to be having that experience as like a 22-year-old was like, it was really upsetting. And I think that's something that's not really spoken about. And even like my lower back, I still have issues like with like pain in my tailbone ever since I had Liv. And obviously that's a risk as well because you're laying on your back and you've got all that pressure from the baby and you've had a needle inserted into your spinal space. So these are all things on a minor scale that I'd personally experienced. And I've heard stories from countless women of much worse than that. So, yeah, I think it is so important that women are properly informed of these because they're not telling you in the delivery room that these are likely to happen.
Absolutely not. So there are some quite serious risks where they absolutely should be telling you these things before they insert it, but I definitely do not see it enough. But it's not a time to gain informed consent because I feel like it's just, how can you really give properly informed consent when you're really not even taking in the information that someone's telling you because you're in labor and you're in pain. There are some quite really serious risks involved with getting an epidural, and I think that's why it makes it so serious that nobody can tell you to take on these risks or expect that you should take these risks on because
they can't make it compulsory.
Everyone has like a different stance with the risks that they're willing to take for themselves, and some people that these risks will absolutely not be acceptable and something that they don't want to do, and some people for if they really want an epidural they're happy to accept these risks. But I guess so we'll sort of go into them as well, but some of the more serious risks are things like infection, an epidural headache, which is like a persistent headache that lasts for days after you've had an epidural where you can't even physically sort of like sit up. So whenever your head is sort of elevated upwards, you have this like severe headache, and they have to do an epidural. Oh, cool. So Jade, I just saw your question and we will go over that as well. But they have to sort of do like a blood patch, which is sort of like a similar procedure to doing the epidural again in order to be able to fix it. It can cause breathing difficulties. It can cause temporary or permanent nerve damage. Pain in the back, which is not resolved. It can lead to seizures, and it can even lead to death if it's not done properly, which is, of course, these things are, you know, 1 in tens of thousands of chance, but if some people aren't willing to take that chance on, I'd rather have 0 chance of those things happening by not getting an epidural.
Yeah. And while all those risks are scary and that women should be informed of these, not necessarily like in antenatal care even, like this should be discussed at length, I feel. But epidurals significantly interfere with some of the major hormones in labour of birth. So it lowers your production of oxytocin, which is your love hormone, which is also responsible for making your uterus contract when you're in labour. So I'm just reading through my notes here because I've jumped all over the place. The epidural also totally obliterates the oxytocin high that you get after your baby's been born and when you're breastfeeding. This peak of oxytocin is the highest that a woman will ever have in her life. And it's honestly like such a transformative experience. I harp on about this all the time. Like birth is transcendence, like it changes everything. And when you have an epidural, you don't get these feelings because everything has been interfered with. So that can affect like breastfeeding and bonding with your baby. And another important hormone, prostaglandin alpha is another thing that's produced from the epidural. So it's, you know, there's significant hormones in our body that are designed to assist us with birthing. Endorphins are another one. They're like our natural pain relief, and like they peak and dip throughout labour to support our surges and our pain. And obviously that's all been messed with as soon as you've had an epidural as well. And I mean, they're really important ones to me. Like, it's just messing with your natural chemistry and the way your body's supposed to function and the way your baby's supposed to behave during the birthing experience too. So, I mean, it's quite significant.
So, like, oxytocin is also a really important hormone for breastfeeding and for bonding. So if you're interrupting that hormonal flow during labor and birth, you're interrupting those hormones after labor and birth as well. So that's how it interferes with breastfeeding another way, but also it interferes with bonding, which is hugely important. So postnatal depression is absolutely on the rise, and it's because we have interrupted all these hormones that are so necessary to bond with your baby. And I feel like at a time when our world is kind of a bit in crisis, we need like love and empathy and compassion, like now more than ever. But also suicide is a leading indirect cause for women, cause of death for women in the first year.
Women death, yeah.
So when you're causing more birth trauma for the baby and for the mum, you're interfering with that connection between the baby and the mum. Of course, you're going to be increasing chances of postnatal depression, post-traumatic stress disorder that women are experiencing, which also interfere with breastfeeding as well. But to flow on from that, it even has effects for the baby. So there's a link between learning and learning development and things like that in children for women who have postnatal depression. So these are all the things that we're contributing to if you sort of start interfering with them.
It's such a flow-on effect, really, yeah.
And the endorphins as well. So endorphins, like you said, act as the body's natural pain relief, and they're released during labour. If the body's not feeling pain, then it's not going to be releasing these endorphins as well. Endorphins are a pheromone, so they're kind of like contagious. So when the mother releases endorphins, the baby also experiences those endorphins as well. So if the mother's not releasing those endorphins, the baby also isn't getting those endorphins during labour and birth.
Yeah, and I think you'd obviously have experienced this a lot of times, that when like that post-birth high that everyone in the room feels, like it's really something else, isn't it? That the whole vibe is just, it's kind of indescribable, isn't it?
It's totally addictive. It's why, like, a lot of midwives and midwives, like that feeling is, it's totally indescribable, and it doesn't happen at every birth. And it's sad, and women shouldn't miss out on that, especially when it's something that they're being recommended without having these discussions first. I don't think that's fair.
Yeah, well, it's hard to make a informed and decisive choice when you aren't being painted the full picture in the first place. Like, you can only make decisions off what you know at the time. Like, you don't know what you don't know, and that's why it's so important for women to educate themselves when they're pregnant. Really seek this information, talk to people who can help elaborate on this sort of information. Because if you're not asking, like, the hospital's not going to tell you. Care provider generally isn't just going to launch into this. I've never had that happen in any of my pregnancies. Anyone be like, oh, so this is what I'm going to teach you. Even at the hospital antenatal courses that I did with my first, like, they're like, this is an epidural needle, and this is where it goes. It looks scary. Don't have one. Like, that was pretty much all we got, and I was like, oh shit.
Yeah. I guess I want to add in there, that this kind of just does seem like an attack of the epidural sort of conversation, and it's definitely not our intention to do that at all. It's just we want women to be really informed with the decisions that they're making, especially if they're being pressured to make these decisions without having this information. And I think it's sort of not fair to tell someone, oh, this is an epidural, it's scary, don't get one, without giving them the tools that they can use instead. Especially since hospitals have, like, some hospitals, every hospital is different, so you really need to contact and ask the questions about what it is your hospital is restricting or what it is they're recommending at this point in time, because some hospitals have stopped the use of nitrous because it's an inhaled gas, so they don't
water immersion
particles, and they've stopped water immersion. So they're two huge tools that women Oh, sorry, and above that as well, they've limited supports. So we know there is support, so much supporting evidence, especially the use of doulas and like support during labor and birth reduces the chances that a woman will request an epidural. The same with using water immersion as well. Women are less likely to request an epidural if they have access to the bath. So taking these things away from women, well,
really pushing them into a corner.
Yeah, women were probably more likely to request an epidural during this time anyway because they're already scared going into these situations. But yeah, taking these things away from women and not giving them the tools that they can use otherwise is not fair either. So I kind of do, I guess, like want to give us a little spin in here that like both Larni and I do have birth preparation sort of services that we offer women where we can go through and talk about all the tools that you can use. And actually there is like quite a lot of things that you can do to manage your pain other than getting so definitely contact us because we could just like probably talk for way too long about what else is available to you and what else you can do. But yeah, was there anything else that you wanted to add?
Oh my goodness. I'm just like, there's one thing I think that is quite important. I don't know if we touched on it. So with having an epidural, obviously you're numb from either like across your abdomen or pretty much like from your waist down, which restricts like, you know, how you can lay during birth. And Sarah, like, do you want to talk about just briefly from a like midwife perspective of like why that's not really conducive to like birth on your back?
Okay, so when you've got an epidural, it really does differ for every woman, and it differs between anaesthetists as well. Some epidurals are very light and they're very abdominal, and women have great control of their legs. And for some women, absolutely like dead legs. They're very heavy. They can't even like they couldn't wiggle their toe if they tried, sort of thing. So it obviously does, in the fetal monitoring and an IV, it really does restrict the movement regardless. So you're not able to get up and move around as much, which is so imperative during labour and birth because firstly, our pelvis is not one bone. It's not fused. It absolutely has a huge amount of momentum, especially a movement and ability to expand during labour and birth, which is so important because the baby kind of doesn't just come straight down. The baby has to come down. There's a
wiggle.
Pelvis, it has to like turn to the side, wiggle around. So when you're working together, these things flow a lot more easily. When you're laying on your back, you're literally compressing the size of the pelvis by 30%, which is a huge amount, especially when literally there's like centimeters of room for the baby having to come out in like certain ways based on the shape of its head and things like that. So that's why it has to do so many turns and stuff like that. So reducing the size of your pelvis is obviously going to impact your baby being able to fit through your pelvis as well. When your coccyx bone as well, it's that kind of like curved bone at the back. When you're laying on your back and you're on the bed, that coccyx bone doesn't have the space to be able to move out of the way. But really, there's all these beautiful photos coming out now of women laboring on all fours and forward leaning, and their coccyx bone is like the sacrum like pops out of the way to make more space for the baby to come through. So it is
incredible.
Really, so you're reducing the ability for that to be able to happen as well. So that's why it takes longer to push your baby out because it doesn't have the space to fit through that it sort of needs to. That's when you're increasing the chance of a shoulder dystocia because the baby doesn't have the ability to sort of like move around and maneuver and things like that. What else? Yeah, we're not designed to go. Absolutely not. It's not comfortable.
No. And you're sort of working against like gravity as well. Like the baby's head's quite heavy and the way it like pushes against the cervix to dilate effectively. Like, I mean, you're just messing with everything in that way.
Yeah.
Restricting blood flow as well. Like you're told not to lay on your back your whole pregnancy, but then they give you an epidural and you're stuck on your back for potentially like 10, 12 hours.
Yeah. Another one as well that's the pelvic floor is anesthetized. So the pelvic floor like plays a really important role when it comes to pushing out your baby, because as soon as your baby's head hits your pelvic floor, that's when you get that real urge to push that is completely like uncontrollable. But also your baby does a sort of pivot. So when it comes down, it hits the pelvic floor and it kind of does this little turn. When the pelvic floor is anesthetized, the baby's kind of can't do that pivot and that turn. And then that also leads to increased need for like forceps delivery and things like that.
Yeah. Oh, there was a question up here, Sarah, about when is an epidural considered necessary in labour, in your opinion?
I still don't really like the necessary word. I guess even if your care provider is recommending you an epidural, that doesn't necessarily mean that you need to have one. So I think when an epidural is warranted is when a woman is fully informed and when she wants one. Circumstances that do come up outside this that you might get a recommendation for an epidural is if you've been in labour for a really long time and you don't have the support to encourage you to sort of keep labouring. Women kind of get really undermined in that situation because obviously hospitals don't see women labour for a long time, especially when it's your first baby. It's actually not abnormal to labour for more than 24 hours. And absolutely, I have seen it and been in those situations. But when you step into a hospital environment, if you've been there for more than 12 hours, they're like, okay, this is too long and we need to get things going. So usually sort of undermine women. They're like, you're really tired, you know,
It'll let you have a rest, get your energy back.
You've been labouring for this long and, you know, you've only gotten to this, so you've still got this much more to go, when really labour does not work like that at all.
It is not linear.
But it's really, once the epidural is put in, then they're like, okay, well, you're comfortable now, so let's put up like the Syntocinon, the induction drug, and get your labour going a bit more quickly, which is kind of counterproductive because what you've done by getting having an epidural is potentially prolonging your labour anyway. So it's kind of, that's where that cascade of intervention sort of does come in. I've worked with women who have had other health concerns where they've been recommended an epidural, one of them being high blood pressure because it does lower your blood pressure. But there's actually other things that you can do.
Like epilepsy would be another indication for an epidural. Yeah.
One where they don't want too much strain on the woman and her body during labour. So cardiac issues where the woman has a lot of strain on her heart already. If the body's not experiencing pain, your heart rate won't, this is the rationale, won't like accelerate, and it won't put more strain on your heart. But I have looked after and worked with women who do have concerns with their heart, who absolutely that hasn't happened to them during labour and they've chosen not to have an epidural. You can use breath work and relaxation techniques which can lower your blood pressure and lower your heart rate.
Very effective.
Yeah. Trying to think of other situations. So one of the recommendations is, so the recommendation for an epidural in labour at the moment started off for women who were suspected or confirmed cases, because they're obviously not wanting to put their body under more strain of labour. But that very, very quickly led to all women, the recommendation for all women. And that's sort of the scary thing about everything that's going on at the moment. It's all being, you know, all these things are being pushed forward under the premise of, oh, it's our concern because of the virus. But I fear that these things will sort of get stuck in place and won't really
how long is it going to take before these restrictions lift? Like, so just say like everything's sort of starting to go back to normal, and it's like, okay, cool, like let's change these policies. Oh no, like, you know, I feel like we've fought so hard.
So there's been I don't know, it's taken, you know, 10, 20, up to 40 years for water birth policies to come into some hospitals. They're not even in all hospitals yet.
Not all, no.
There's been places that I've worked at where for years people have been providing the evidence and trying to get water birth into like policies accepted, and that's just such a long process, and hospital policies take so long to change. And even though we have all this evidence-based like recommendations at the moment for how we should be providing care, it's the hospital policies that are lagging. Yet these hospital policies have come in very quickly, so that kind of just proves the point. That's not, they're just very sort of picking and choosing what is suiting them.
Oh, this is a little bit off topic, but sort of the same. It's not about epidural, but I was reading today that the guidelines for your gestational diabetes testing have changed now because of this, and they're like not even recommending it for women unless they're in like a risk category now, because it's exposing them to like two plus hours at the hospital. So they're recommending like to have the
HbA1c. Yeah, so that's
that's what I opted for with my pregnancies. But yeah, I'm like, funny how they can change this now, but you know, wonder if the recommendation on that will like change, and it's, you know, opened up a like a precedence in that way to be like, hey, but during this you were like, it's not that important. So is it really that important all the time as a routine across the board recommendation?
Exactly. And I'm curious to talk to anyone who has actually stopped doing it, because I've heard of women recently getting kicked out of home birth, like publicly funded home birth groups or like care, because they have failed, or not failed, I don't like that word, but so they've been diagnosed with gestational diabetes. But if we're not supposed to be testing for it right now because it's putting women at risk by telling them they need to sit for hours in a hospital, then regardless, every hospital is going to pick and choose what information that works for them ultimately.
And why are they not talking about the other risks associated with that testing as well? But that's another
conversation. But ultimately this is about the premise that the only person that has your best interests and your baby's best interests at heart is you. So you need to be really informing yourself and making decisions that feel right for you and your baby. Don't let fear and coercion sort of steer you into making these
decisions. Like steer your birthing journey. Like at the end of the day, you're the one that is like going to mother after this, and live with the effects of the decisions that you make, like during your pregnancy, during your birth, during your postpartum period. And like getting over like even minimal birth trauma is pretty fucking shit, like, let alone like where it escalates and escalates and escalates. Like, it's a really difficult thing in the postpartum period when you're dealing with all these other hormones and like stresses of becoming a mother, or becoming a mother for the second time or the third time or the fourth time or the fifth and so on. I mean, birth trauma just really heightens the stress and the pressure and the doubt that you put on yourself. You know, I just think it's so important to acknowledge that, because it is a really challenging period when you're dealing with those feelings.
Yeah, and it's absolutely not just in the immediate postpartum time at all. Like, these effects are lifelong. Since becoming a midwife, I've had a lot of like women with adult children tell me about their birth experiences and how it's affected them. These things don't go away. So absolutely,
they get passed on to your children, like generational trauma.
Yeah, you store that in your body, especially like so many children are retold their birth stories in a really negative way. It's like, I was in labor for blah, blah, hours with you, and this is what I had to go through. And the damage that's doing on a generational level is huge. Like, we need to be changing the narrative around birth, and with everything that's going on at the moment, it's it's really under threat. Just
more
in general.
Important than ever.
Yeah. Yeah, so
I think as well, Sarah, with the hospitals potentially saying you need to have an epidural, like in a group that I'm in, I saw a post from a woman who works at a hospital saying that they're recommending epidurals to everybody because gas and the water immersion has been taken away from them, so it's just prepping them because they're not going to have those things to like that they normally have to deal with in labour. And it's like, you're freaking telling a woman that they're not going to be able to do this before they've even had a chance to give it a go. Like, it's so undermining, and it's so wrong on so many levels to be like, look, there's no gas now. So they're assuming that you're going to need that anyway. there's no water immersion now, so there's no way you're going to be able to birth this baby, so let's just do the epidural. I mean, I know they're not saying that, but I mean, that's the undertone to all of this.
Oh, absolutely. Yeah.
And like, where does it stop? Like, where does it freaking stop? Like, we are autonomous over our own bodies, and if they can dictate this, like, yeah, you will have an epidural here, or sorry, birth somewhere else. Like, what else can they dictate that you have to do? Or even in the immediate postpartum period, like, no, we're taking your baby now. Like, again, like, not to be fear-mongering, but like, it is just a slippery slope. And while this isn't happening now, I think it's really important to be realistic and prepared for the fact that, you know, like, these things do happen, and they do happen in Australia. While it's not a standard thing, you know, like, it does happen.
Yeah, and like, this has all happened so quickly. It's like, where else can it go from here?
Yeah, for sure. I could talk for hours about this.
It's absolutely not all doom and gloom, though. Like, there's definitely options out there. Like, women are hiring external support like doulas, and they're labouring at home for as long as possible. A lot more women are opting to home birth and free birth and all these sorts of things. So there's definitely, it's opening up a lot of channels as well. There's so many birth workers who are offering services. There's heaps of like free childbirth education online and things like that. So absolutely, from like the birth world, we're trying to do what we can to support women in this situation as well. So even though I just kind of like had a bit of a negative kind of like streak to it, this conversation, please absolutely.
But I think in a way it's good. It's not good, the policy, but it's good because it's making people like potentially explore home birth, or see that like free birth is an option. Like, these are things that are just like variations off the normal path that we're funneled into the hospital. And there are other options out there. And again, those options though are there for you, that do your research, like, be informed, like, own the risks. Like, you know, you're making the choices, you have to live with the consequences. Not necessarily saying consequence in a bad light, but you know what I mean? Like, you have to own the decisions that you make.
Absolutely. And that comes to women informing themselves about having a free birth. You have to own that decision. You have to own the outcomes of that decision. It's the same if women choose to go into a hospital to birth. You have to own that decision, because no one else is going to take the blame if something goes wrong in that situation either. It's ultimately like getting an epidural. Ultimately, even if you've been coerced into it or not, it's, if you get an epidural, it's your decision to get the epidural, and you have to own the outcomes of that as well. So I think that's just part of like your mothering journey as well. It's like, you have to take responsibility for informing yourself, for doing your research and owning your decisions, because honestly, that's how you own your power as well. Because if no one else is going to take that responsibility on, no one else is going to make decisions for you, no one else is going to take the blame if something doesn't necessarily work out for the best. So you really, really need to step up and take responsibility for everything. And I think that's part of the process of, you know, empowering yourself during your pregnancy and labor and birth journey as well, because ultimately your power is your own. No one can take that away from you unless you give it to. And that's a hard thing to swallow, because, and like vice versa, no one can give you power either. You can only empower yourself. Nobody else is empowering you. And I think knowledge is a really powerful thing. So if you inform yourself and educate yourself, the more you have to back yourself, the more power that you ultimately have anyway.
Yeah, and the thing I think that's really important, like pregnancy and birth, and the decisions that you make, and like your decision-making process and the way you research things, like, it's just the beginning of like a lifelong parenting journey of making these decisions. Like, as you said, Sarah, like, you know, everything that you do for your babies and for your children, like, it's got a like risk versus benefit. Like, there's consequences to everything, and like being a parent, that can really weigh heavy sometimes, but it doesn't go away. You still have to own that, because at the end of the day, like, you're responsible for your kids and your kids' health and their safety, you know, like, and on the empowerment part, like, what I've been saying to women at the moment is, like, babies are still going to be born. Like, that's not going to change with this pandemic. And like, everything that you need to birth your baby, you already have within you. It's just like, you know, reaching out where you needed to, like, get additional information and tools so you can listen to your intuition and listen to your body and go with that process.
Yeah, that's it. I think this is a real sort of like reclaiming for women as well, like
Yeah,
especially like laboring more at home and things like that, or like we're really starting to notice that, yeah, the hospital doesn't give you things in order to be able to for you to birth your baby. It's just, there's this narrative that's been made that like birth is inherently dangerous and that women's bodies are inherently dangerous and that women need saving
broken.
from
Yeah.
birth and that babies need saving from women during birth, and it truly is not the case at all. Like we absolutely have the ability to birth our babies, and it's just about reclaiming that, especially during this time.
Yeah, like your care provider isn't there to save you. They're not there to birth for you. They should be like
Yeah,
the lifeguard, like watching, making sure you're safe within the waves, getting you back like, on course if needed, but not dragging you around like when you're not asking for help. Like,
yeah.
mm,
Uh,
I love
cool.
where this went.
Does anyone have any questions that they want to ask us? I feel like we kind of
What
jumped
should we
around
talk
for a
about
bit.
next week?
Yeah. Oh my God, let's just see what comes up over the coming week. Hopefully nothing more. Hopefully only a positive thing.